My name is Dr. Cathy Fleming and I'm a clinical radiation oncology physicist at St. Luke's Radiation Oncology Network. And what we do at St. Luke's is that we are using high energy X-rays to treat and cure patients with cancer. So day to day my work is very varied. A lot of it is clinical work, so that's just making sure the patients get appropriate clinical treatment, so making sure that the machinery is working okay, troubleshooting it if it doesn't, checking patient treatment plans, double checking everything that's correct before a patient starts treatment. But the beauty of our job as well is that there's a big part of research and development. So we get to study our patient outcomes, look at how we can improve them, and then we also get to implement new techniques. So when other institutions publish things that they have done and it works for their patients, we get to bring that technology and that technique into our clinic and trying to push the outcomes for our patients. In a clinical job, the work that you do and the projects that you do, you get to see them rolled out. You get to see the impact of the work that you've done on real people, and I find that really fulfilling, and that really helps drive my interest in then the next project and moving forward. What I really enjoy about my work is the variety. So you can go into work with a plan for the week, and that might happen or it might not, because each week brings different challenges, whether it be a piece of equipment is breaking and you have to troubleshoot, try and figure out what's going on, or you get introduced to a complicated patient and you have to think about how we can appropriately treat them, what's best for their needs. And in that way as well, it's a great multidisciplinary environment. So I don't just work with physicists, I work with doctors, I work with radiation therapists, I get to meet patients. And in that sense, you get to see how each discipline thinks and what they bring to the picture, and then together we can get a solution. So it's really challenging to see how others view the situation that I look at, and it helps inform me and teach me also. I just find science fascinating, and what I really find, I really enjoy the clinical work, because I just find when you bring real people into it, I just find the idea that we can do something and we can actually make a difference in a patient's life. That's what really inspires me, and the fact that I can go home and if I've done a good day's work, that might have made a difference to one person, and what more can you want out of your job in terms of job satisfaction. I grew up in a scientific household, so a lot of my family are scientists, and I definitely wasn't pushed down that way. I was definitely encouraged that I could do whatever I want, but clearly those traits were in there somewhere, and all the way through school I love maths, I love science, and I wanted to do all the science subjects for my leaving cert, but my school felt it wouldn't make me well-rounded, which is something that I disagree with. But actually I was very lucky, and I had some really good teachers, and particularly I had a really good leaving cert physics teacher, and in fact myself and another girl from that leaving cert physics class both came on and both went the whole way through and did physics degrees here in UCD, and we're still friends to this day. So I really think that when you train to be a scientist, it fundamentally trains you in how you think. So in everything that you do, you see the world through that prism of the way you've been taught, the way that you logically think. Even though I might not use something like quantum dynamics or something that sounds quite big and scary in my real world, actually just being a scientist and training your brain to see that it influences all that you do in your work and how you see everything in your life. And I find that fascinating, and how I see things differently from how some of my friends who have humanities training see things differently, and how we can bring those two visions together, and they can teach me something about how they see the world, and I can teach them something about how I see the world. So in terms of my, I suppose, experience as a female scientist, I think it's important to say that throughout my career I've really felt encouraged from both in university and then as I started work. And I find, I suppose, it really interesting that my workplace is very diverse. There's a mix of male and female, and in some ways me being a female doesn't come into it, and I think that's really exciting that we've kind of moved forward to that point in life, and we see both the guys and the girls taking their parental responsibilities and all these kind of things. And for me, the fact that we don't see a boundary or a border to being a female scientist is, I think, where we ultimately want to be.